Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also those in Hampden and Hampshire counties, all in the comfort of their own home. And with Porchlight, we have two businesses. One is the VNA side, and the other, importantly, is the home care division of the organization. So I'm very happy to welcome to the program the relatively new director of the home care division, Dewkett, who is a registered nurse and, again, the new director. So, Dawn, welcome to the program. It's great to have you.
Well, thank you. It's nice to be here.
And I say relatively new because it's been a little while now since you started on with Porchlight. When exactly did you start?
I started on December 30th of 2013.
So you have your feet are wet and things are going. And this Berkshire cold winter, of course, has been your first foray back into the Berkshires. So I know it's been a little bit tough, but I hope you don't leave anytime soon.
No, I was born and raised here, so I won't be leaving anytime soon.
That's a good thing, so you're used to it.
I am used to it.
Tell me a little bit about your background. You started your career in the Berkshires, which is your home, and then you evolved through your career from the clinical side, working in hospitals, but then also in the area of research.
I did start my nursing career here in the Berkshires. Actually, I was first an LPN and went to McCann Tech up in North Adams, worked at Berkshire Medical Center and was laid off back in the 80s. I was able to take advantage of what Berkshire Medical Center offered to get my associate's degree at Berkshire Community College, and continued to work for the hospital and went out into home care and pursued a bachelor's degree, which again, Berkshire Medical Center offered, and got my degree at University of Massachusetts Amherst. And about 15 years ago, I moved to the Boston area.
And then what were you doing in Boston? And then that led to work in the area of research also.
I first went to home care in Boston. I worked for a large agency as a liaison, something I'd never done before. And then I progressed into being a clinical coordinator and worked in some capacity for that agency the whole 15 years I was out there, but also worked in research for the Institute for Aging Research at Hebrew Senior Life.
So tell me about the research that you did a little bit, because it does relate to what you are doing now to some extent. I think osteoporosis was one of the areas that you researched.
It was. I worked with a doctor. Primarily, his research is all in osteoporosis. The first research study that I worked on was on hip protectors in nursing homes, and to see if a hip protector and an undergarment could help prevent hip fractures in the elderly that fell. The second big research project I worked on with the same doctor was on vibrating platforms. And that was to see if our elders, and that was in independent facilities, if they stood on a vibrating platform for 10 minutes a day, 7 days a week for 2 years, whether or not it would improve their bone density.
Wow, that's a long-term study.
It was a very long-term commitment.
Did it improve bone density?
The article has not come out yet, so the manuscript is just about finished, so I can't really give out the results of that study because it is not yet published.
Not yet published, but
No.
you have a pretty good idea yourself.
I do know, but I'm not allowed to yet until it's published. Until it's published.
That's
yes.
so interesting, because we always hear from orthopedic surgeons or others that exercise and that sort of, for lack of a better term, that pounding, but not so much pounding, but the interaction with a lot of walking and that sort of thing improves bone health and strengthens bones.
Yes, and the premise of this was that you wouldn't have it wouldn't be as intensive because it was a platform that vibrated just a very slight amount. It would be compared to if you stood on a like the T, when the T's coming in, you stand on that platform. So it was below OSHA standards, so that you weren't, vibrating like that the water would come out of this glass. And it was, the the premise was that it would improve.
So take
It worked in mice.
So take the tea and strengthen your bones, perhaps.
Yes,
if you
take the
stand
tea
up.
or stand on a platform.
Or on a
So,
platform. So that
yes.
should be interesting. Look forward to that. And since you put so much time and energy and effort into it, I'm sure you're very interested to see that come
I am.
out
I'm
and
still in
published.
touch with the group,
Yeah.
and I will be on I will be an author. I'm co-author because I did before I ended that position. I did write a piece of that article.
So now you come to Porchlight Home Care, and it's the home care division. And Porchlight, of course, known for the Visiting Nurses Association, the Lee VNA, for so many years. The home care side has come in recent years, formerly Berkshire Home Care, now under the Porchlight name and with this umbrella. So tell me about why today home care is so important to work along with the VNA system.
It's important to have home care so that individuals can continue to stay in their homes. If without the home care side, which is the private side with home health aides, homemakers, companions, many individuals couldn't remain in their homes. And we work closely with the VNA so that we can, if someone that we're servicing requires more skilled service, then we can refer them to the VNA for skilled service for things that we cannot provide. And it does help for people to be able to stay in their own homes, which has kind of been something I've always been interested in, back to research, because that was, our research was to improve the lives of elders, and aging in place is one of the things that is an improvement that was other research that was being done in the institute that I work for. So even if we think of our own parents, I'd like that to be for my parents as well, to be able to age in place. And as we get older, sometimes we need help. So Porchlight Home Care can offer that help. And having an agency is better because you have the insurance and the safeguards that are in place with an agency when you have somebody in your home.
And looking at that, so just so people understand the difference between home care and the clinical side of the VNA, quote unquote, it seems to me the VNA is a higher, well, it's clinical, it's a clinical level of care. Of course, you yourself are a registered nurse, which is very important, I know, for Porchlight, because clinical strength is something that's near and dear to Porchlight's mission. But what are some of the tasks that you would see for an individual working in a home under the home care side as opposed to the VNA side? What are the differences?
The differences are our staff can buy groceries for people, go and buy groceries. We can take people to get their groceries if they can get out of the house, but they can't drive anymore, so our staff can do that. They can also provide personal care. They can provide homemaking, which is cleaning of their home. They also can provide companionship or door-to-door service, where we can give people rides from home to the doctor's office. We do have nurses that go out and open each case, so that there is a nurse that does an assessment of the home first, so that if there's ever an issue, either the home health aide has a question when they're in the home, they can call, and they always have a nurse they can talk to.
And that's very important, because when people start to progress in their situation with their health, and perhaps it becomes more difficult for them to live in their homes, it doesn't always have to be necessarily a clinical scenario where
No.
that's the case. Often it's some of those smaller tasks, making meals, being able to get dressed in the morning, in a satisfactory way. These kinds of things that are the early things that you have to be able to address. Again, if the goal is, and I think most of us believe that this should be the goal, that mom or dad are able to stay in their home.
Exactly. And so it can be something as simple as making them breakfast. Maybe they aren't able to dress just their lower extremities. We also encourage people to be independent. You don't want them to lose their independence. And it could be that they need someone even to stand by so that they're safe while they're doing that. If there are people who are a fall risk, and it's safer to have somebody there when they're doing things.
And looking at that overall, concept of aging in place, tell me your thoughts on that, as it relates either through the research that you've done in the past in that work, and just overall in healthcare. It seems as though that's the ideal scenario. And perhaps we have systems that are in place and available today that were not available a decade or 2 decades ago. So we have a better ability to enable that. In other words, someone who had to be in a nursing home perhaps 15 years ago or even 10 years ago now can remain in their home.
More and more people can remain in their home, and if you have a good system in place, you can, if you have a good communication with physicians and the VNA services, as well as the home care services and the families, because the families are a big part of it, so that they can stay at their homes with our services.
Tell me about how important partnerships are in order to provide a better service to the community, because it's not just Porchlight, but there's the hospital and there's long-term care facilities, and seemingly we should all be working together.
We should be. It is important, so it's important to work well with the facilities around you, whether they be long-term care facilities, the assisted livings, other groups that are in, like the Alzheimer's Association. It's important to work well with all of those so that we can provide the best care amongst us for the community that we serve.
So tell me a little bit about what brought you into the area of healthcare. You chose this for a career, and certainly you're a registered nurse, but you started out in the clinical side of things as an LPN, and you talked about that a little bit. But what was that initial inspiration that brought you into this profession?
I enjoy making a difference in people's lives, and I enjoy helping people. I truly enjoy getting out into the home and into the community and doing some health education. I also really enjoy mentoring new nurses. That is something, and recognizing that in somebody else that walks into my office applying for a home health aide job, and realizing as you work with them that they would make a wonderful nurse. We absolutely need more dedicated nurses in the profession. And
tell me what it takes to be a nurse. What is that something special that you're looking for that tells you that someone is right for this profession? Because honestly, not everyone can possibly be a nurse. That it takes a special person, right?
It does take a special person to be a nurse and to do a good job in nursing. It's not an easy job. You do everything. That is one of the things you have to kind of put aside, things you may have your own prejudices about, and just take care of people and take them where they are. A good nurse has common sense. I think that is the first ingredient that you have to have. You have to have common sense. You have to be willing to put someone else first and put your patients first. And you also need to be able to not take that home with you, because sometimes it can be extremely emotional. You can get emotionally involved, and you need to understand that you can only do exactly what you can do. I feel like as a nurse, I've done some hospice nursing as well, and I really enjoyed that because it's as much of a privilege to be present at someone's birth as it is at their death, and make it a good death.
And then on the home care side, the position of home health aide is so very important. And often, we have conversations here on this show and so forth. It's with, the directors, it's with administrators, it's with some of the clinical leadership and so forth. But often we don't get the opportunity to speak with people who are, quote unquote, there interacting with those patients. They probably wouldn't want to be on this show necessarily. But I can tell you this, that that isn't at the heart and soul of where the care takes place, with home health aides, in the long-term care setting with CNAs, and even, of course, with Porchlight CNAs as well. So it's really the heart and soul.
It is the heart and soul. They are the ones that are on the forefront. They are the ones in the homes taking care of our loved ones. They do a wonderful job. And it's important for the nurse to be there too, to support them in that. If they have questions, if they have concerns, I try to keep, and I have already done this in this position, where they can come in and talk to me if they're having concerns about either what's going on in the home. I had someone just come in and talk to me about a patient on hospice that they weren't really aware of what that meant, and it was uncomfortable for them. So that to explain that to them, so they are the forefront.
How do you approach that? So you hear quite a bit about this and how in healthcare everything is very methodical. We follow a process and there's protocol, but in the end, a big part of it must be, if it's not, it should be, that human care and compassion. And you're talking about that end of life thing. And a lot of it, of course, we in healthcare are very pragmatic, and sometimes we forget about that. And I think healthcare has rightfully been open to criticism because of the lack sometimes of compassion from clinical people communicating with families. So for you, how important is that, whether it be in a hospice situation or in any other situation?
It's important to keep the lines of communication open, both with our caregivers that are in the home as well as the families, so that they know exactly what is going on. And we also work really hard to do that. And sometimes that's difficult because we do serve a big population, but we do strive to keep in communication. So not only with our caregivers, but also with the family members, who some of them may not live in the area, so that it's even more important to stay in touch with them and keep them abreast of what's going on with their loved one, that maybe their mother or father, their aunt, their uncle. So we do try to do that. And I think it's easier today because not only does everyone have a phone where usually you can reach people, but there are people who want to stay in communication via email, so that it is much easier to keep in touch. But it is a big job.
It is.
It is.
And I think that's that personal touch. Customer service.
Customer service
Healthcare
is
has not
important.
always been known as the bastion of customer service. And I know a lot of organizations are trying their hardest to do better at that, and providing incentives for their employees and having better training and that sort of thing. But I think it's safe to say that there's room for improvement in the healthcare world for customer service.
Yes, there's always room for improvement. And to look at each situation when maybe things haven't gone well, to see what you could do to improve. I think that's another thing that we always attempt to do as well.
And when someone has a loved one who may be starting to fail in some areas, whether it is getting around the house, whether it is cooking, or whether it's some of those basic tasks that are needed, what would you suggest the first thing that a family does in that scenario? They need to talk to somebody, right? So what would you suggest that people do if that's the case?
If they notice that someone's failing, you need to turn to somebody in the healthcare field, whether it be, we oftentimes get phone calls with questions, so they can always feel free to give us a call. There's always somebody to answer. If you're not comfortable with that, go to your physician. Sometimes those physicians' offices are so busy that they may not have the time to take to answer questions. Call your elder services if it's an elder, but just reach out to some, and Porchlight absolutely would always be willing to answer questions.
Fantastic. Well, Don Dewkett, great pleasure having you on the program. How can people get in touch with you at Porchlight on the home care side?
On the home care side, you can feel free to call me. My phone number is 413-243-1122, and my extension is 257.
Fantastic. And I believe your email is Dewkett, and that's Dewkett, at porchlighthomecare.org. Don, it was a great pleasure having you on the show.
Okay.
And we'll definitely have to bring you back because there's so much to talk about, because the home care side and the VNA go hand in hand. And I think it's such a great partnership that's there in our community.
Yes. Thank you.
Thank you very much. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.